Senator Pouliot.
Thanks. Sounds like we're done with question period for now. First, I want to start at 30,000 foot level, which is that a lot of this bill, the genesis of it, is based on data, which we seem to have a lack of continuity, consistency with, even from Maine CDC. I appreciate the sponsor's desire to push this out in an effort to try to collect more information and make sure we're moving in the right direction. But I'm concerned that if we truly have a crisis, which demonstrates a need for us to pass legislation to help fix the crisis, and we don't have any consistency around the data that's being presented, how can we move forward with passing a bill that is really, in essence, a solution in search of a problem? We haven't been presented with concrete evidence around the number of individuals who would be affected by this bill. The numbers range from 2,000 to 10,000, plus the post-secondary population, which could be anywhere from 4,000 to 7,000 students. So I have a lot of concerns about creating a group of minorities by discriminating against kids and adults that are unvaccinated. Kids like Colin Aponte, who last year was the first student in the state of Maine to win the Maine Spelling Bee and the Maine Geography Bee. A kid who was celebrated by this body as an outstanding student, and now will be an outcast and a pariah if we pass this bill. I have concerns about creating a group of minorities who will be discriminated by this bill. What about the unvaccinated parents that go into the school system? I mean, we're not passing any legislation here that requires everybody in the state of Maine to get vaccinated. So how is this really going to help solve our problem? And finally, we heard from testimony here that herd immunity really exists between 92 and 95%. That was testimony of a supporter of this legislation, Lisa Tappert, who stated herd immunity is the protection conferred on a community by a level of community vaccination of 92 to 95%. She went on to say, when asked if we were all set because the vax rates in Maine were around 95%, that we are all set at this time. Honestly, we don't even have continuity from CDC about what our vaccination rates are. I can't in good conscience support legislation that doesn't even have with it the assurance that it will solve the problem that we believe exists in this state.
Representative Fecteau.
Thank you, Madam Chair. I wanted to just generally say my piece and then be done with this. To quote 12-term Congressman Ron Paul, an OBGYN, giving the government power to override parental decisions regarding vaccines will inevitably lead to further restrictions on liberty. After all, if government can override parental and personal health care decisions, then what area of our lives is off limit to government interference? Concerns about infection from the unvaccinated can be addressed by consistent application of the principles of private property and freedom of association. Instead of justifying new government intrusion in our lives, the vaccine debate provides more evidence of the need to restore respect for private property and individual liberty. In my own mind, this bill overrides body autonomy. Philosophically, I would think that the members of this body, this is where our political bubbles would intertwine, and we would be interested in preserving liberty. This bill targets a minority who has stated they do not consent to this intrusion. The verdict is still out on how our new Mainers feel about this. In the governor's Welcome Home campaign, we still do not understand how our Somali, Syrian, and Iraqi neighbors feel about this. And furthermore, when I raised my right hand when I joined the U.S. Army in 2006, I took an oath to defend the U.S. Constitution and protect this nation from all enemies, foreign and domestic. And with all due respect to the sponsor and to the medical professionals, I consider this bill to be an egregious constitutional attack. Thank you.
Representative Drinkwater.
Thank you, Madam Chair. It's been a lively debate, a lot of testimonies over a lot of time. You know, I come from a family that absolutely believes in vaccination. I lost an uncle with tuberculosis at the age of 31 when there was no cure. So we, as a society, we've come a long ways. When I went to school, there was probably 5 vaccinations you needed. Today, before you even reach kindergarten, there's a tremendous amount of vaccinations. We've heard testimony to say that we're somewhere between 92 and 95%. I don't think we'll ever get to 100%, worthy goal, but I don't think we'll ever see it. We've heard testimony from legal that the state has police power in the event of an outbreak, and it can be used anytime by the governor, and we witnessed it during the Ebola vaccination with our own nurse from the state of Maine. So what we're talking about is removing the religious exemption. Now, we heard a tremendous amount of testimony about medical exemptions. Some doctors said, oh, it's easy to get medical exemptions. I give them, quite freely. We heard a lot of parents say, well, the doctor said I wasn't eligible for medical exemptions. So what we're talking about here is just removing religious exemptions and perhaps sliding those people over to medical exemptions and see what the medical community says about it. So in my way of thinking, we are violating the civil rights of that 5 to 6%. And we've heard testimony here on another bill about civil rights, and we all believe in civil rights. I don't think that we should be squeezing the civil rights of the religious community. Therefore, I'm going to oppose this bill. Thank you.
Representative Sampson.
Thank you, Madam Chair. So I just want to address the committee and for the public that's out there to know what's been going on sort of behind the scenes. So I presented an amendment. I feel that we do not have all the facts. I think we're putting the cart before the horse. And I'm deeply disappointed that we're not doing our due diligence. We are targeting a minority, 5% of the student population. We're segregating and marginalizing them. This is a small group of our society. We're using coercive measures and threats to force people to comply or be expelled from school. So much for FAPE, free and appropriate public education. This is a civil rights issue, and I'm not okay with it. Are we okay with segregating kids? Are we okay with adding to the mental health crisis when we stigmatize them and remove them from school? Are we okay with violating people's bodily autonomy? This is not about vaccinations. This is about bad legislation, and I will not support it.
Representative Rudnicki.
Thank you, Madam Chair. A couple of things. I'd like to refer my colleagues to a yellow paper that was put on their desk that affects their individual school districts that are in their districts. And I'll use mine as an example. I have 2 school districts that I represent. And if you look at that particularly, there would be in the MSAD 49 school district, there would be 182 students removed from school based on this bill. If you look at the Mercer and Smithfield schools, which is RSU 54, the Skowhegan area, and if you look at the whole school, the district as a whole, that's 200 students removed. So in those 2 districts, MSAD 49, $1.7 million would be affected to that district, and the RSU 54, it would be $2.2 million if we are actually kicking students out of school and segregating them from being able to go to school based on this law. So because of those reasons, because of civil rights, because of the fact that it should be a choice and parents' rights to what they want to put their child through, I am not going to support this bill.
Senator Pouliot.
It just blows my mind that my well-intentioned colleagues on this committee, who all believe in the importance of a public education, we come here every day to support that, are going to willfully say to a significant group of Maine's public education students, we don't want you in school unless you follow these things, which they have a whole multitude of reasons why they're not doing it. These individuals that are not getting vaccinated, maybe some of them don't have the right information. Maybe some of them believe in, unicorns and fairy tales. But there's a lot of really well-educated, intelligent parents that are making these decisions that they feel are in the best interest of their children. And to say to them, sorry, we don't want you, it flies in the face of what we all sit on this committee and talk about all the time. And, I mean, where is the risk? Where is the risk? We've been told by Maine CDC that our numbers hover around 95%. Okay? There's some that say in pockets, yeah, it's around 80 to 85. I think we should spend a massive amount of time going into those districts to educate, in those areas where we have the pockets that could potentially become a problem, but aren't yet, to educate them about, the importance of vaccinating. I support the goals of this bill, but I vehemently disagree with the implementation. For us to say to a whole group of students, we just don't want you anymore, it flies in the face of what we all espouse to believe in on this committee every single day. I just don't understand how anybody could support legislation that's going to segregate a group of students in the state of Maine.